Oh, so much for that. All right. All right, family. I hope everybody is doing well. Wow. Psalms 91. That's right. That's right. Yep, family. Boy, we got a tough road ahead, but you know, we can do it. The way I see it, we've lived through everything in this country. Peace to everybody. Shalom. And Shabbat Shalom to my Hebrew family. Wow. Yeah. All right. So we got 96 people. So I'm just going to allow a few more people to come in and then we can get started. Yeah, it's going to be tough, y'all. I mean, I'm reading stuff from doctors and nurses. It is not good. And I have to tell you what some of the health officials in my state came on local TV to tell us. And I'm going to probably do that in a separate video. But it's not good. It's not the rosy story that Trump is trying to tell us at all. I mean, they just gave it to us straight here in New Jersey. They just laid it all out straight and they didn't mince their words and we got it right between the eyes yesterday. So, I will share some of that with you as well. Okay, no matter how scary it is, just give me the truth. I'll figure out what to do. Yeah. So before we get started, um, oh, well, yeah, I'm not surprised about that, True Royal. We are talking about YouTube. Well, ladies and gentlemen, our top health officials told us here in New Jersey, they said, look, everybody is going to get coronavirus, period. They told us straight. Everybody is going to get it. And they just pretty much ran down, how they are struggling in the medical care system right now. I mean, let's face it, none of these doctors and nurses were ever trained to handle a pandemic. They are struggling, y'all. They are struggling. And up in New York got slammed with people going into the hospitals. It became real overwhelming for them up in New York. And I said, that's going to be all over the country eventually. But they got slammed really bad with a lot of people coming in there. And then I was looking at another article, Italy Italy lost 763 people overnight, died. They got so many people going to the morgues and the crematories there. They said they can literally not take any more people. They can't take any more people at all. So I don't know what they're going to do. 763 people died overnight. It is scary. But yeah, this is what the top officials here in New Jersey told us. Everybody will get it. Everybody. Yeah. No, they didn't say the majority. I wish they would have said that, because there's always a chance you won't get it. But they said to us, everybody will get it. So, all we can do is keep our immune systems up and make sure we do this for our families. A lot of things went through my mind after being told that, everybody will get it. So I started thinking, okay, what if everybody gets this damn thing all at the same time in my house? How are we going to look after each other and care for each other? If we're all down, what happens then? So, a lot of things went through my mind. There's a family in New Jersey where all 7 members of the family at the same time got coronavirus. 3 died. The other 4 are still trying to fight their way through recovery from it. So, as scary as it may be, I'd rather know than not know. Trump is trying to paint this picture that it's going to be out of here. It's going to be gone. No, it isn't. No, it isn't. And I'm glad we were told, that way we don't have to live through no fairy tale, and we'll just deal with it as it comes. So that's what we were told in the state of New Jersey by our top health officials. So, yeah, 4 died. I'm sorry. Thank you for the correction. 4 died. So, but those folks didn't exactly look healthy. Damn near all 7 of them were obese. So I don't know if that had anything to do with it, pre-existing health condition. Yeah, it was a white family. That's true. So, now I can proceed and know what to expect now. I'm not going to live my life out in a fairy tale. I like everything up front, and we got it up front, plain and simple. So I guess everybody, depending on your states, they're all handling things differently. But as tough as it is, I'm glad at least I know. I'd rather know than not know. So, NBC News surveyed doctors and nurses around the country to see exactly what's going on the front lines, ladies and gentlemen. And their responses were probably what many of you would expect. They're struggling, and they really are. They don't have enough equipment, not enough masks, not enough gloves. And some nurses are actually reusing, which they're not supposed to do, because if one patient is sick, you can cross-contaminate by wearing the same gloves. So because they're so short, this is what's going on, y'all. America is a country completely unprepared for a pandemic. I think you all know this by now. And financially, America is doing bad. I don't know how many of you followed the stock market Friday. The stock market plummeted well over 900 points. They said the losses on Friday was equivalent to losing the finances for the last 3 years. Okay, and that was just one day. So things are not going well. We are probably, more than likely, by the time we reach summer, will be in a recession. And we shall see how things go. People out here got to calm down and stop running out after everything. You know, there wouldn't be shortages if everybody would stop buying up all the masks and gloves to the point where our medical professionals don't have access to it. And if you are not a doctor or a nurse, you know, stop grabbing up all that stuff because they need it, especially if they're going to be handling patients. And now that I know, you know, hey, no matter what we do, we're going to get it. So, yes, I'm going to stay on my soursop tea. I'm going to drink my ginger tea. I found my chaga. I'll drink my chaga tea, all of that stuff. You know, it doesn't mean I can't take care of myself because we know it's coming. All right, so let's get into this story. So this came out on NBC News, ladies and gentlemen, and the title is "This System is Doomed." This is what the doctors and nurses are saying. This system is doomed. Okay. Turn this down. All right. Doctors, nurses sound off in NBC News CV survey. So a total of 250 healthcare workers responded to this social media survey. And I wish I could say, it would say, hey, you know, our hospital got it together. We're prepared. We're ready. None, zero, none are prepared, ladies and gentlemen. Even if you like the hospitals by you, that hospital is still not prepared. A hospital nurse in Michigan says she and her colleagues have discussed bringing in bleach to make their own disinfectant wipes. A pregnant nurse in Ohio says she has no choice but to attend to critically ill patients without an N95 mask. And a healthcare worker in Georgia has resorted to scouring local hardware stores in effort to secure protective masks. So they have no protective mask, and in some cases, gloves. So these nurses are going out on their own to try to find these things. There are just some of the stories told to NBC News by more than 250 healthcare providers on the front line of the CV pandemic, including many who work in major hospitals. The accounts were solicited through an NBC survey, pushed out on social media about access to personal protective equipment, which they call PPE, a broad term for the gear such as masks, glasses, gowns, and respirators donned by healthcare workers to protect against transmission of germs. Nearly all who responded said there were shortages of PPE in the hospitals, outpatient clinics, and offices where they worked. Many reported being forced to rotate or reuse supplies, including surgical and N95 masks, for fear of running out. Many also said they were facing shortages of basic sanitary supplies, including hand sanitizers and disinfectant wipes. Okay, I'm going to play just the audio to this video so you can hear it.
Hundreds of doctors and nurses across the United States are rallying around the hashtag #GetMePPE. PPE stands for personal protective equipment, and it protects doctors from getting infected or from infecting others. It's things like masks, gowns, gloves, and many seem to be running out or running low on supplies. We're going to talk to Esther Chu. She started the hashtag #GetMePPE. Can you tell me about the hashtag that you started and what motivated you to start it?
It was really clear across my networks, my online networks of healthcare providers, that we were all running out of this PPE, or personal protective equipment. Those are things like face masks, the N95 respirators that filter out small particles, gowns and gloves, and face shields, and eye protection. Basically, every type of equipment that we need to create a barrier between us and patients who have infectious disease of all kinds, just COVID-19. And so a friend of mine who's actually not even in healthcare, who's a lawyer, encouraged me to start sharing the stories. And I thought, why don't we start a hashtag and see if we can get people to jump on? So we came up with this #GetMePPE hashtag. And I went on Twitter and asked people to share these stories, and people jumped in. And it was actually even more alarming than I expected.
What we saw under your original post, hundreds of nurses and doctors from across the US sharing photos and stories. What were some of the most surprising ones to you?
My physician friends posted a bag that her hospital was using. They put her name on it because you were supposed to put your PPE together at the end of your day, put it back in the bag, and reuse all of it the next day. People were posting pictures of.
And is that normal? Is that normal, or do you usually take your PPE home?
Never. I mean, you never store your PPE for the next day. It goes right into the garbage can. I mean, I've never used any of these items for more than a single patient because of the risk of transmission. We generally take them off right after a patient, put them right into the garbage can. And so to reuse these items is really a change from usual practice. I mean, these are simply not normal times.
A lot of the comments that I saw on your thread were people asking to help. What can they do?
Yeah, it's been really remarkable how people have been offering to help and to donate items. There are people who have PPE, things like face masks or respirators at home, just for whatever, for gardening or for doing crafts, construction projects. We can certainly use those, and I encourage people to reach out to their local hospitals or healthcare systems and see if they will accept these materials. What I saw was a week ago, hospitals and healthcare systems were saying we can't accept those kind of donations. This week it has changed dramatically, actually, and it seems like most places are willing to accept these, so that because we know that it's our only stopgap measure until we start seeing more mass production of these items for us.
Okay.
Nice.
Hey, Dad, can I?
Okay. All right. So that was a nurse account, and they showed pictures of the different nurses that went out there. And by the way, thank you, Loveline Turner, for the super chat. And so we know that there are problems here in America. All right, there are problems. You can sit there talking about they're just trying to scare you. They're not trying to scare you. There are shortages of all of this equipment around the country. And even if it is in warehouses, it's not reaching the hospitals. So what do they do in the meantime without this stuff? So yeah, we got to all think about it, because if we're going to all ultimately get it, some of us will end up in the hospital. And if they're not changing these gloves and masks like they should, then they're cross contaminating people. Screw all that being scared. Tell us the truth. All right. NBC News was not able to independently verify each account, but where possible, the facilities were contacted and given an opportunity to respond. The nurse in Michigan, who is based in Flint and works primarily with, so she works with people that get viruses. This is what she does for a living, and said that nurses at her hospital have been rationed one N95 mask each. So they get one mask and they have to keep this one mask on and keep reusing it over and over, and are being required to store them in a bag and reuse them against manufacturing guidelines. Nurses on her floor, she added, have also been unable to obtain enough disinfectant wipes. We ordered 5 containers the other day and we only got one, she said. Like many medical professionals who spoke to NBC News, she asked them to remain anonymous for fear of losing her job. 1 container of bleach wipes for 42 beds. I don't feel like my hospital is failing us, she said. It's the whole system that's failing us. We certainly would not ask a firefighter to fight a fire with a spray gun. Yeah, you're right about that. Okay. It's a moral obligation of our government and our employer to provide safety equipment to those of us on the front line, she said. All right, here's some more audio. Let's see here. Okay, I don't know why that's not playing, but moving on. If it pops on, then I'll stop. We are unable to protect ourselves. The overwhelming majority of the medical professionals across the country who responded to the NBC News survey expressed concerns about the lack of N95 masks, which offer more protection than surgical masks. A healthcare worker at a hospital in Indiana described a scenario that medical staffers can only get the mask when a patient has tested positive for the virus, but the faculty has no way to confirm a case. There are many possible exposures in my hospital, but are not equipped with test devices in order to confirm the cases. That's been the problem countrywide. There are not enough tests in the United States. They just ordered 1 million, I think 2 million up in New York. You know, they're trying to get all kinds of equipment because they're now taking an overwhelming amount of people coming in there with all the symptoms of CV, and they don't have enough tests for each person that comes in. That's a problem. That's been a problem nationwide here in the country. We are not allowed to wear proper PPE because they are not positive, and because our hospital is short on the PPE. We were also told that we are expected to keep the N95 mask for several days and several patients, and that they can be disinfected with Sanicloth wipes. You know, you're not supposed to do that with those masks. They're supposed to be disposed. Okay. we do not have N95 masks, so we are being asked to intubate patients with normal masks, wrote a pregnant nurse from Ohio. It's unacceptable. We are supposed to treat every patient as suspected positive, but we are unable to protect ourselves. You know, no defense. If I were her, I would not work there pregnant. I think that's too much of a risk on her baby. It's not worth it. Okay. So the N95 mask filters out airborne particles and aerosols. And the Food and Drug Administration advises that neither N95 mask or surgical mask should be used more than once. But in response to growing shortages of PPE, the Center for Disease Control and Prevention has loosened the guidelines on proper use and reuse of masks. On Thursday, the agency advised that bandanas and scarves could be used by healthcare workers in place of a mask as a last resort. That is a damn shame. Isn't America supposed to be one of the richest nations on the planet? And now you're telling your doctors and nurses to put on a bandana? Whew. Sounds third world, don't it? The fact that a recommendation like that came out from the Center for Disease Control is mind-boggling to me, said Dr. Adam Freilander, an emergency physician working in Atlanta. There was a time when a recommendation came from the CDC. We knew that it was evidence-based guidelines for how we could protect ourselves from becoming sick with a potentially fatal illness. Now we know the recommendations are coming from a place of desperation, acknowledging that these supplies are unavailable. A nurse who works at a major hospital in Massachusetts and spoke to NBC News on the condition, she wanted to remain anonymous, said the medical staff have been told they must reuse their N95 mask 5 times before they are able to get a new one. It's scary to have to reuse a mask, she said. At the same time, it's like, what are you supposed to do if there are none to be had? A nationwide problem. The U.S. Department of Health and Human Services said in a statement this week that the agency has been steadily deploying PPE to areas in need from the Strategic National Stockpile, the nation's supply of pharmaceutical and medical supplies intended for use during a severe public health emergency. We have been transparent that more supplies are needed. Hence, the request to Congress for the additional funding so we could procure more and scale up production, the statement said. But you know what, y'all? This is the end result of giving all of your jobs to China. I mean, when I read this, that's the only message I'm getting in this whole thing. If they would have kept some of the more critical manufacturing jobs on the soil, you wouldn't be looking at this problem now. But everybody is looking for all of this hard labor for pennies on the dollar. It's nothing but pure greed. And this is why we are in a position now. If you read through this and close your eyes, you would think we were talking about a third world nation. Seriously, you would think we were talking about a third world nation, not the United States. But this is happening in the United States. We have been transparent. Okay, I read that part. The role of the SNS is to fill the gap temporarily until states and localities working with the private sector can respond to the state and local needs. The survey responses reveal the scope of the shortages as many as medical professionals pleaded for the government to step up and deliver the supplies. We have no proper PPE, wrote one survey respondent who works in a hospital in New York City. We are being told to come to work even if you had a COVID exposure. Wow. So they want these nurses and doctors there even if they've been exposed. Wouldn't they be exposing someone else? So this is what they're telling them up in New York. Even if you've been exposed, you bring your ass to work anyway. Wow. This system is doomed for failure without immediate help from the military. We need PPE, vents, staffing, more hospital beds, more tests. In the meantime, health systems and staff are being forced to improv. So I guess I gotta come up with a makeshift mask and all that stuff. One doctor who works in a rural health clinic in Virginia said that clinics are increasingly being asked to fill the gap and send their PPE supplies to hospitals where the need is greater. But that, of course, leaves clinics and the patients they serve exposed. There simply isn't enough stock, the doctor said, who spoke on the condition. Okay, he wanted to be anonymous too. We have no N95s or gowns. We have limited surgical masks. This is a nationwide problem, even on the private side, he added. No clinic in this country, or hospital for that matter, is going to have enough equipment. The limited supply of PPE has forced some hospitals to take extraordinary step of asking the community for help. Seattle Children's Hospital and Washington have received thousands of donated protective equipment and is currently accepting curbside drop-off of additional masks, gowns, and gloves. Thanks to members of the local and international community, to date, we have received 15,100 isolation masks, 1,200 N95 respirator masks, and 400 surgical masks from donations, a hospital spokesperson said. So it took the public to step up and help the hospital. It took the public. Thank you, Mark Stewart, for the super chat. So it took the public to step up because this government is too sorry to get this stuff to these hospitals nationwide. 3 survey respondents reported that they were asked to work with patients who tested positive for the virus without adequate protective gear. That is jacked up. So now your medical professionals are open to taking this home to their families. They don't care. They don't care. Others reported that they faced disciplinary action for using PPE outside of specific circumstances. A memo distributed this week to Monmouth Medical Center, that's here in my state, Southern Campus in New Jersey, informed staff that PPE must be worn in all rooms containing individuals with suspected or confirmed cases, but that staff could be disciplined for wearing masks, gloves, and gowns outside patient rooms. We are carefully managing current inventory of items to ensure adequate supply of materials to protect our staff and the community. Dr. Robert Morin a plastic surgeon who works in the emergency room in major hospitals in New York City and New Jersey, said that such policies put into place in response to shortages put healthcare workers at risk. We don't need hospital administrators going out of the way to make us sick, he said. And he's right. So if they're not changing this stuff, then everybody that they're caring for is now open to getting coronavirus. Everybody. Wow. The chaos, the lack of supplies, the lack of equipment, he added, the numbers are just going to keep going up. Some survey respondents and others who spoke to NBC News reported searching for PPE at local stores or on websites like eBay. A doctor in Philadelphia who is married to a doctor who works in a major hospital in the city said that her husband researched. So he went out and searched for N95 masks just so he could buy them on his own at 4 hardware stores before his shift yesterday and could find none. He says, it's my duty. She said he's proud of doing all that he can and able to do right now. But I am so scared. I can't even begin to tell you. And this is a doctor speaking like that. A doctor in San Jose, California said her hospital is working hard to get N95 masks for all doctors, but they are in short supply. She shared messages with NBC News from doctors she knows who are worried about their own morality. The doctors are talking about making living wills and what will happen when we are faced with this, she said. All of us are wondering which one of us will die. So, ladies and gentlemen, it's bad. America cannot handle a pandemic. And I mean, this is exactly what the survey is saying. America can't handle a pandemic. You know, and you can tell anyway. You know, anytime you got a place like South Korea, they're doing 12,000 tests a day. America can't even do a few thousand. That should say a lot. That should say a lot right there. And it's a shame that this is what our healthcare workers are saying around the country. This is what they're saying. I don't know how they do it, because I don't know. If I was a healthcare worker and I had to work under these circumstances, I don't know if I would be confident going home to my family thinking any day I can walk in my front door with CV and infect my entire house. So these workers are saying the system is doomed. Wow. You know, and this happening in a nation full of high IQ people, y'all. You know, it's amazing. Everybody got a high IQ, but then when something goes down, those high IQs are worth a toilet paper at that point. Used toilet paper. So, wow. This is where we are. I mean, at this point, you probably do a better job taking care of yourself at home than you would get help in these hospitals. Yeah. You know, so here we are claiming, you know, people in this country, because I never walked around making this claim, people in this country claim that, you know, we're supposed to be an advanced nation. Well, this doesn't look so advanced. Nia Sky, you are right about these hospitals. My sister is a nurse, and she said they are being careless. Yeah. Wow. Hmm. Yeah, they're overwhelmed, you know, and unfortunately, it's going to get worse in this country. You know, you think March was bad? Wait until April gets here. We ain't seen nothing yet. No, the problem with all of these governments on the planet, Corey, they're all corrupt. You know, you're dealing with a government that's corrupt from the start. So you can't expect them to fix. They're going to be slow to fix it. So, so just understand, you may be looking at a nurse if you have to go in the hospital that's been wearing the same face mask and gloves for the last week. Okay, and now they're in the room to try to help you. Yeah, all I can say is, okay, Sherry M. I worked in hospitals. Those white nurses are entitled, lazy, and incompetent once they pass the nurse's exam. Somehow I believe you. Well, you may not have to go, Regina Palmer, to a hospital. I mean, a lot of these people are self quarantine right at their house. They're not going to a hospital at all. $193, 793 deaths in Italy. Wow, Dark Visitor. Woo. That's too many overnight. Yeah. I wonder if they're practicing social distancing in those hospitals. I bet you they're not. How can you do that on jobs like that anyway? You really can't. You got to have contact with the patients. Yeah, but you know what? Mocha latte, Shanti, that's not the age range that's dying in America. Go look at the age range of the ones in America. Most of them are from the age of 20 to 59. Overseas, like in China, most of those people were older. But here in America, the demographics of the people that have died with it are in their 20s, all the way up until late 50s. That seems to be the big age range here. So it's not the same as overseas where they may have, an older population dying of it. Is a whole different story here in America. So I was astonished with how many young people were getting it here, but the age range is younger here that's getting it. Mr. Pirate Brain, that's because we have terrible diets. Yeah, you got it. You definitely got a point right there. Yeah, but we got to be careful with that. Black people don't get it. Yes, black people do get it. And there's been plenty of examples of black people with it. And we got to stop saying that, because if you believe that, then you're not really protecting yourself. You're going out here with the assumption that you don't have to protect yourself. You're black. You're not going to get it. That's not true. You should be protecting yourself regardless. Don't get caught up in that mess. There's been plenty of examples of black people with it. So y'all cut that mess out about black people can't get it. That's a lie. Yeah, I saw that tiger, the ghost tiger. I saw that. They're stocking up on guns like crazy. All the gun stores are sold out. So what are they going to do? Shoot the coronavirus? That's so stupid. These people, they look for any excuse to buy guns. I mean, place is a joke. No, I mean, it has to be said. I keep hearing it over and over, and it's not the truth. We got NBA players that are black with it, and there's been some black people just within our communities with it. Here in my state, there's a black doctor right now that has it. And he's an older man in his 60s, and he got coronavirus, and he's a black man. So we got to come off of this black people can't get it. Y'all got to stop that mess. Yeah, well, look, those people down at the beach yesterday in Florida, they said they weren't worried about it either, but that doesn't mean you won't get it because you're not worried about it. Well, CD, I am not worried about that. You know, these people are going to do what they're going to do, but you got to understand, most people, when they do harm to others, they do harm to people around them. They don't cross over in somebody else's neighborhood. They do that right in their backyard. Yeah, PD Chicago B1, a black nurse in Illinois died from it. Yeah, so we got to stop this mess about black people can't get it. Y'all got to stop saying that crap. It's not all of you saying it, but there are some that are. Well, you do what you need to do. We don't need the coronavirus for you to protect yourself. You should have been doing that naturally anyway. I'm all for people protecting themselves. You do what you got to do. I didn't need the coronavirus to tell me that. I'm okay as long as they don't shut. Well, see, that's why Trump and that Defense Act that he enacted the other day, that is some of the things that we are protected from. There are certain things businesses cannot do to us. That's why he activated that. The last time it was activated was during World War II. They shouldn't be doing that anyway. They shouldn't be shutting your phones off and shutting your power off and all that stuff. No, All right. Well, I just got notification, y'all, that Chime was the entire state now is on a full lockdown. The state of New Jersey just popped up on my screen. So we're in a full lockdown now, statewide. I know they were talking about some of the businesses that are open, they want them closed. No, I be first, IS, not saying blacks can't get it though. It seems select. I don't think it's select because look, we have seen from the richest athletes down to people that weren't so rich in the community that still got it. So that tells me it doesn't matter. Anybody can get it. And I don't think we should get stuck on that. Anyway, like I said, if you are believing that we can't get it, then how much are you protecting yourself? You're not protecting yourself. I can't get, you're out here strolling around with this thought and idea in your head. I can't get it. I'm black, and that's foolish. Yeah, I did hear about that CD, but I noticed nobody is jumping on that because I don't believe it. Yeah, I don't listen to 45. You know, he wants everything back up and running because, see, for him it's all about money. It's all about money. That's why he wants this place back, because he sees how much money has been lost on Wall Street. If we get back to normal, then they can get back to making their money. And we can't worry about that right now. America's not making money anyway. They're not. I mean, the stock market, look, anytime you lost so much money in one day that it wiped out 3 years of gains, then you're doing really bad. America's doing really bad. Yeah, I mean, at the end of the day, Trump don't have that much power. He don't have all that much power, just like any other president. Just be careful out here. I know we're on lockdown and New York is on lockdown. I mean, at the end of the day, it's not slowing anything down. It really isn't. So just be careful. All I can do, being that we were told everybody's going to get it, I'm just going to continue to keep my immunity up and do what I do. We can't just throw in the towel because the potential is great that we're all going to get it. So, ladies and gentlemen, I'm going to go ahead and conclude. I do have another live stream coming up around 3:30, and that's going to be on the apocalypse of Abraham. And in there, it has, 10 different judgments that are going to hit. So usually the first one is always disease. And we are seeing that now. So it's going to go over all 10. So if you're interested, you can come and please listen in. The more the merrier. If it's not your thing and you don't want to do that, then you have a wonderful day. I guess I'll see you on another live stream at another time. So, ladies and gentlemen, I pray for each and every one of you every day. I really do. At this moment, I just pray for my brothers and sisters every single day. I pray that you're safe. I pray your families are safe. And if you can be spared from all of this, I pray for that too. Shabbat Shalom, family.